Hi guys, good morning from beautiful Mazatlan where it's, I don't know, 28 degrees, feels like 31 they say. That sounds about right. It's overcast, but they say the sun's coming out later today. Had a little rain last night, not a bad night. It feels wonderfully cool and not so humid this morning. So welcome to my channel, welcome to the new subscribers, welcome back if you're not new. You're one of my long-term viewers. I appreciate you all. But today I want to issue a little warning to people that are thinking of moving to Mexico about some of the things you have to deal with. Man, I'm dealing with it today. Oh, stress. I found moving to Mexico fairly easy, like the paperwork to get my residency and all that stuff. It takes time, but pretty straightforward, and Mexico really treats you well, and it all worked out great. So I have my residency, permanent resident, long-term resident here in Mexico. I've been here for almost 9 years. It'll be 9 years in February. And this is September the 13th, 2022. And anyway, my live-in girlfriend, my wife, Lupita, she needs a knee surgery. And we've known this for a while. We were told that it was a possibility back in January. And then the doctor said, if you go and get physiotherapy, we may be able to avoid this altogether. So she went for 30 sessions of physio, and he sent her for an ultrasound. I think it's an ultrasound, some sort of radio sound, so he could look at her knee and before and after the physio. And I paid that out of pocket. It wasn't a ton of money, but it was a fair bit of money to a guy on a small pension. And then I asked, well, what would this surgery cost? And he said, oh, it's a 40-minute procedure. We do it one morning. Worst case scenario, she might have to spend 1 day in hospital. And he says, you're talking $2,000 US. And I said, okay. Sad part was, by now, after all this physio and everything else, it was no longer January, it was April. And I'd been dealing with my insurance company because I have healthcare insurance through my former employer. I was an air traffic controller. And I dealt with them for 3 months. Yeah, in April. Because I do have some money in the bank in Canada, but Canada makes it interesting. And this is the warning to you. If you're a Canadian especially and you're thinking of moving to Mexico, Canada makes it very interesting. I had a substantial bit of cash in the bank in Canada, and I came down here only to find out that they'll only let me take out 7% of that cash per year. And I'd already done that in January, and we'd used it for some bills and paid down some stuff and bought a couple things we needed, and I was a little cash poor and living again on my pension and getting by. And so I thought, well, I'll jump through the hoops with the insurance company to see if they'll pay for this. Man, it was like going down the rabbit hole. I dealt with the one company that I'd been paying premiums to for 30 years, from April till, God, at least July, before they said, oh, you're in Mexico. Yeah, that's why my address is Mazatlan. Oh, you don't need to be talking to us. You need to be talking to this other division we have that goes by another name, which I'd never heard of before. Found out this morning, they're in New Jersey. So Canadian Air Traffic Controllers, through the Canadian Air Traffic Controllers Association, has a group medical insurance policy that is administered out of New Jersey. Anyway, to describe this whole process as a cluster would be understatement. My God, I was counting the emails. Like, there's been 40, 50, 60 emails just piling on. And every time they say, oh, you got to use this certification number, and they give you a 6-digit number. Oh, we're gonna expedite this because we realize you've been waiting a while. Now we're going to give you a shortcut number. That's only 5 digits. That saves a lot of time. And then they realize, oh, you're in Mexico. Yeah, you got to talk to our other division. Of course, when you talk to the other division, they don't know who you are. You've only been paying premiums for 30 years. Who are you? What do you want? Oh, I said, I've sent all that. I've sent all our medical records and everything to the other division. Oh, we don't talk to them. We can't get that from them. You'll have to send it to us again. Oh, more and more emails and sending and PDF files and photographs and, oh my God. Oh, piss off the good humor, man. Honest to God. And it goes on and on. I mean, they try the patients at Job. And so anyway, the hospital, they kind of came to my rescue. They said, we have a person employed full-time to talk to these insurance companies because we know what that's like. I said, oh, thank God. So anyway, they do that. And I said, the insurance company is telling me that you haven't sent them the itemized breakdown for the surgery that they want. Oh, yes, we've sent it. We've sent it. I'll come to find out he was still sending it to the first company, not the second company that I'd asked him to send it to. And he hadn't included their 6-digit number, their certification number, like he said he would. Anyway, finally today, I get an answer. Now, this is September. We're talking this whole process started sometime January, I think. And get an answer from the insurance company. Oh, yeah, we're all ready to go. And all we need is this itemized issue. No, it was the day before yesterday, I guess I got an answer. We're all ready to go. All we need is this itemized list from the hospital. I said, okay, I'll have them send that. And asked them to do that. Said, make sure you include this 6-digit certification number. And, yeah, done. Okay, so this morning I get it, and they said, oh, they've sent the estimate, but they didn't itemize anything. They just said one item, surgery. And they had the wrong number. They had the number from the other company, so it took us a while to find it. I know. There's a lot of Dwight Burditts in the world. It's not like my name's Bill Smith. It's, I could understand. Anyway, yeah, without that 6-digit number, in spite of the fact that I've been paying them premiums for 30 years, they were having a hard time locating me. So anyway, got the 6-digit number, got the one itemized estimate, and I kind of expected since January there'd be some inflation from $2,000 for this day surgery that takes 30 minutes. And there was. Now it's $87,000. I think there's been a currency conversion error somewhere. I don't know. I just, like, if I had any hair, I'd pull it out. I've already banged my head against the wall a couple times. See that red dot there? That's where I did that. It's frustrating to say the least. It's just part of the joys of being an expat. Just a warning to you all. Anyway, I'm still smiling. Life is good. I'm in sunny Mazatlan. Hope you're all having a better day than I am. Thanks for watching. Bye for now.